Talk to us a little bit about the Biden administration's plan to take care of more hospital needs given rising cases of COVID, the flu, and RSV, this triple-demic, as it's called.
Yeah, and certainly we've anticipated that this could happen. We've seen this in the last 2 winters where COVID has really been the problem. When you add in what we've seen over the last few weeks and months with RSV and now kind of the increase in cases of influenza A that we're seeing everywhere, we wanted to make sure that we're communicating to states, to localities, to hospitals, the resources that exist that we've built and put together to kind of really rally to their cause. And so making sure that we're tracking closely what's happening around the country and we're communicating closely with states and local leaders so they know what they can request from us and what we can surge to them. We're really making sure that we've got our strategic national stockpile ready to deploy additional resources and tools to hospitals and other clinical spaces. So really applying the lessons learned from the last 2 years of the pandemic to make sure that we're ready for this moment if we do see a real increase in cases, which we're starting to see that uptick.
And one new part of the preparedness here, the federal government is giving out free COVID tests again, 4 tests per household. Well, what went into the decision behind this? How is it paid for? And do we have enough supply to meet demand?
Yeah, I guess it's one of those what was old is new again. We rolled out covidtests.gov in January of 2022. We had that program running really all the way through September, distributed millions of, or really tests to millions of households, and so really made a huge difference for a lot of individuals. We had to pause that because we were really depleting our stockpile, but we got some additional funds from Health and Human Services. So no new dollars from Congress, really just shuffling dollars within the agency to try to make sure we can deliver this service to individuals. Again, this is 4 tests per household. We think it can help stem the tide, make tests more accessible to folks at a time where we think they're going to be of greatest use. So when you anticipate an increase in cases, it's really useful to just have a test at home within arm's reach where you can figure out if you've got COVID and make decisions from there. And so that's really what went into it. We do think that it can help. We've seen that before. It's not indefinite. We know that we can only run this program but for so long before, again, we deplete that stockpile. But it was really important that we made that available to the American people this winter.
It would be important to test before congregating this holiday season. Moving on, we hear a lot about protection, notably how vaccines prevent serious COVID complications. But with rising cases this winter, would you personally suggest businesses, places of worship to consider mask requirements for people who come indoors?
Well, I think the nature of mask requirements now are really predicated on those COVID community levels. You can check on, the covid.gov website, and every Thursday we update what the levels are. So if your community has medium or high levels of spread, it's recommended that people consider masking again. And I think that's an appropriate step for folks. And so what I would tell people, and I would tell, folks in these kind of congregate spaces, is if you want to keep that space as safe as possible, if your COVID community levels do go higher, then you can encourage people to follow that CDC recommendation that includes, masking. And I think that's the reason why with this winter preparedness plan, we're making masks available in more spaces. For a lot of people, they still do have some masks, but we want to make sure that people are able to get their hands on masks and use those when things get a little bit more concerning as the season goes on.
Dr. Webb, we've got about 30 seconds left. A new federal study just released from the National Center for Health Statistics says that long COVID symptoms have contributed to the deaths of over 3,500 people. Now, it is 0.3% of all U.S. COVID deaths. Are there treatments to prevent long COVID and to cut back on the impact that people have from their symptoms?
Well, I would say the best treatment to prevent long COVID is to not get COVID. And I think the best ways to do that is to be vaccinated, to wear masks when levels are higher. Those are things that are critical. We do have some indication that maybe treatments may be helpful. But again, we're still learning more every day about long COVID, and we want to get that science out to people as quickly as possible.